on children with special needs, and the power of early intervention. Just by showing us today, you have taken a beautiful step, whether you are here as a parent, an educator, or a caregiver, or simply someone who believes in the potential of every child, and that matters. Now, let me explain you why we are here. We are here to touch the hearts. Behind every child with special needs is a family that just wants to understand, to help, to love better. And sometimes all we need is someone to show us how. This session is about that how. How can we recognize the signs early? How can we give children the support they need before their struggles turn into sufferings? How can we as a community walk beside families who are navigating these often difficult emotional paths? Before the truth is, every child deserves a chance to shine in their own way, in their own time. As I said that the session is about how, किस तरीके से हम बच्चों के स्ट्रगल्स, बच्चों के जो स्ट्रगल्स, जो उनकी जिद्दोजहद, जो उनके एफर्ट्स होते हैं, उनको किस तरीके से पेन में चेंज कर देते हैं, उनके मुश्किलात उनको किस तरीके से तकलीफ में चेंज हो जाते हैं. This session is all about how we can recognize it. And now, what to expect. Paint a clear and gentle picture. Today, we are going to explore what special needs truly mean. Special needs का असल मतलब क्या है? And it could be challenges in communication, learning, behavior, or even social interaction. These challenges are real. I invite you all to the fully present listen not just with minds, but with your hearts. Please feel free to use the chat box to share your thoughts, reflections, or questions. Your voice matters here. And chances are someone else might be feeling the exact same thing, but unsure how to say it. So let's begin the journey of awareness and compassion. Let's open our hearts to new understandings and to the children who remind us every day that strength looks different in every little soul. With that, it's my pleasure to hand it over to Dr. Jaya Chandran. Dr. Jaya Chandran, we are honored to introduce Dr. K.R. Jaya Chandran. He's a psychologist, a counselor. He has more than 2 decades of experience in special education, inclusive education, psychological counseling. He holds a PhD master's degree. He completes his specialization from the University of Melbourne. He is a licensed A-grade practitioner, an active researcher, trainer, and a speaker. Dr. Jaya Chandran continues to be guiding force in the field of special education and rehabilitation, offering valuable support to both families and professionals. With that, it's my pleasure to hand it over to Dr. Jaya Chandran. We are all ears and all heart ready to learn from you, sir. Welcome.
Thank you, ma'am, for the wonderful introduction. Same time, I must thank Dr. Ahmed, pediatrician in the Ministry of Health, and Dr. Shafiq from International Indian Professional Organization. And I know that there are many parents, professionals, trainers, teachers. I think from different walk of society, we have a lot of people from different part of Saudi Arabia. I know some of the people are from India, UAE also, some participants participating in this webinar. It is my pleasure to see you all here in this fine afternoon. I hope you are not sleepy after having lunch. This is weekend. I'm sure that I'm not going to satisfy the academic needs of all the people here, because we have a multi-group of heterogeneous community here participating the program. In fact, I am just giving a brief or introduction about supporting children with special needs, focusing early intervention and the services which are needed at the early stages. It's labeled as holistic services. This is the word Dr. Ahmed brought. That is a wonderful word. This is definitely, it's a holistic service for addressing to cater the need of children with special needs. So I'm splitting this session in 3 different areas. First is the categories of special needs children, to know, to basically to understand what are the type of special needs children need support in community and public education system, and how to identify early intervention. How to identify, that's a difficult task to explain here, but just hints I can give in this session, and the holistic services. All these components which I am going to explain here, it's based on my experience, vast experience, I will say, like 30 years experience in India, Australia, and Saudi Arabia. And based on my academic support to academic institutions, research institution, Ministry of Education, and various institutions in India, Saudi, and Australia. So before going in detail, I request all of you to have a note about your questions. I'm sure that I cannot explain everything in this like a maximum 1 hour session, but end of the session, I will be answering some of the question. If I am not able to, because we have time limit, at the end, if I cannot answer, you can have a communication with me later, and I will be happy to give all the questions, by phone or in a video mode. So let's move it forward. Can you, excuse me.
Yeah, sure.
Yeah, 1 second, there is a technical issue.
Yeah, it's visible now.
Yeah. Now we are focusing special needs. What is special needs? Can anyone reply? I know that you are focusing disability, so it is for us now it's disability. Children with disabilities is our special needs. But in fact, in our educational system, if we are focusing National Policy of Education and National Education Policy 2020, special needs are different categories. See, the minorities children who are isolated from the mainstream community, they are special needs children. The children, those who are facing financial difficulties, or the children who are in living in slums or such backward areas, they are also having special needs. So in a broad category, if we are focusing here, we are going to discuss about children with special needs. Means the children who are facing some sort of physical, emotional, behavioral, or sensory disorders, who need support in their daily living, education, further rehabilitation, or employment, or to be a part of society. They need some sort of special care, need, or some sort of assistance. So such group of children we are going to discuss. Then about intervention and holistic services. Yeah, please have a look in this. We have 21, according to Person with the Disabilities Act 1995, we identified as 14 categories of special needs. But India realized that there are more, for example, dyslexia, learning disabilities and all, autism and all, not identified as disabilities in the beginning, 1995 Disability Act. But in 2016, Parliament passed Right of Person with the Disabilities Act. There, we labeled 21 categories. These are the categories. Blindness, we are not going to detail everything. Blindness, low vision, leprosy, QAD, locomotor disability, dwarfism, intellectual disability, mental illness, cerebral palsy, learning disabilities such as dyslexia, dysgraphia, dyscalculia, hearing impairment, muscular dystrophy. I'm not going to read everything. So such a categories, but some of the categories I have bold, it is in bold letters. Can you go through this? Intellectual, learning disability, speech and language, autism. Yeah, that's all. That four category, I put it in bold because these are the every week, and I am getting many children with all these. Other categories, blindness, Parkinson's, sclerosis, thalassemia, it's very rare, especially in Saudi Arabia. It's very rare. Thalassemia, hemophilia, and I never got any such children in our educational setup. But other categories, blindness, low vision, hearing impairment, all, there are many. But now, the main issues in our public school system is education of intellectual disability, learning disabilities, speech delay, language delay, autism, such categories. And I mentioned one more word, virtual autism. It is not in our category, but after COVID, after parents are able to buy all the type of high sophisticated screens and as a gift of recently, I'll tell you one story. Recently, I was in very near my home. One market is there, Nesto Hypermarket. I was just going there. One parent and child was walking towards me. The parents came and told me, "Sir, can you help me? My son, he's having some problem." He's not in front of the child only. The parent was telling, he's not listening to me. He's always in phone. So I need your support. Can you help me? I said, it is very easy. Which grade he is studying in? He is in grade 8. Okay. So why he is using phone? No, because I bought one phone for him. I asked him, who bought this phone for him? Sir, I bought the phone for him as a birthday gift during his last birthday, that when he was studying in grade 7. So grade 7 child, father bought an iPhone as a birthday gift. So who is spoiling the child? Child is not studying and he is always addicted to phone. He is not listening to parents. The same parent is telling me, sir, he is not listening to me, means father labeled that the child will not listen. Can you help me? I said, yeah, this is very easy. Come with me. I called the parent and child. I was walking towards the Baldia box, garbage. I said, take the phone from him and put it in the garbage. So that is the only solution. There is no other solution for this one. See, nowadays, for everything, I'm sure that there are many parents in this webinar. So as a matter of escaping from the child, if they wanted to watch some program, parents are busy with the reels and children are busy with the cartoons. So such a situation, especially after COVID period, there are many children, hundreds of children are approaching me parents are approaching me for assessment. They have virtual autism. Always the child is holding phone and scrolling. After some time, no need to do anything. Child is sitting like this one, he will scroll. In air also, he can scroll. This is the condition. This is not considered as a disability at present as per the Disability Act. But I put last, I hope you can see that. Virtual autism is mentioned. It is not the real autism, but because of the screen addiction, children are developing the behavior of autistic children. So these are the main category of children with special needs according to Indian legal system. So 21 categories, and the last one is virtual autism. It is not labeled. Any question? If you have any question, please raise, and otherwise I'll move forward, and end of the session, we can have a discussion. Okay, Dr. Shafiq?
Jay sir, they are putting the questions in the chat box so that
Yes.
the flow will not be disrupted. So meantime, if you feel that we need to back, we can unmute them and then ask.
Let's move forward. So I'll focus some of the activities. See, intellectual disability is mainly on IQ, the quotient of the child. Usually, our IQ is 100 or 100 plus. Okay, but for the convenient, it is labeled as the condition is 90 plus. Usually, 90 to 120 is considered as the normal IQ level. Okay, if it is less than 90, see this, such children will come in intellectual disability. So it is like 90 to 70 level, 70. If IQ is between 90 and 70, it is considered as mild category of intellectual disability. Before, around 15 years back, they were labeled as mentally retarded. Nowadays, we are not using that term. It is intellectual disability or mentally challenged. Now, Prime Minister, in a few years back, he labeled this as Divyang for disabilities. For all the categories, he labeled as Divyang. But this is basically based on intellectual level, less than 90 to 70, it is mild level, 70 to another 20, 50, it is moderate level, then severe and profound. If it is less than 30 means profound level, they cannot be educated, but all the other children, it is educable or trainable group of children. So low intelligence level, intellectual disability, mild can be integrated in the mainstream school, public schools, with some support, sort of support services. Basically, they will be delayed in speech, communication, to understand the concept, toilet training, daily living skills, all such things, they will be delayed, but can be trained in the early stages, and they can be sent to schools with the minimum support services. Then moving forward, mental illness, we are not going to discuss. Cerebral palsy, it's a non-progressive condition. You know that children who are in wheelchair, they cannot communicate well, they cannot sit properly. Sometimes they will be sitting like this on, hand movement, leg movement and all. It will be mostly will be wheelchair. Such children, but rare in our school system. But such children need, physiotherapy, speech therapy, occupational therapy, and all. And some of the children, such children are enrolled in our school. I am talking from Riyadh. Some children were, I know they studied in mainstream schools, but most of the children, cerebral palsy with intellectual disability, can't be educated in the mainstream school. So such children need support service system in a special school or rehabilitation setup. Moving forward, specific learning disabilities. This is the main category in our school system. Their learning disability means their IQ level is normal, 90 plus or 100 plus. Some of the children are excellent in intelligence level. Maybe you can say 130, 140 they can reach. Okay, but some of the area they cannot perform. For example, some children, I had one boy in Indian public school a few years back. He was getting 100% in mathematics, but he was failing in Hindi. His language, he was failing. So he was having dyslexia. It's a language disability. How it comes? See, mathematics, he is getting full mark. He was getting full mark. Language, he is very poor. So this is called dyslexia. So such children, there are many children in our school system. Such children need support services at the early stage. You can identify such children. So when I come to the early intervention, I'll explain that. So learning disabilities, some children are very poor in calculation. It is called dyscalculia. There are many such group in different categories are there within the learning disability group. So some of the area, they will be very good. Some of the area, they cannot perform like normal children. From the very beginning, the professional can identify how they are, behaving, their eye contact, their fine motor, their language delay. Through this, assessment, a proper assessment, we can identify such children in the early stages, and we can, if we can prepare a program, educational program or special education, such services at the early stages, that is very important. Then such children can be educated very well from the beginning. Next one is speech and language disability. There are many children, especially now after COVID period. As I told you before, most of the children are using screen. Mothers, even feeding time, they are giving screens to the children. One hand they are holding phone, other hand snacks, milk or something. So this is the condition. Always watching Cocomelon or some other programs, some cartoons. They are always addicted to this one. In fact, we are spoiling such children. See, after 2020 only all this happened. How the other children were growing before 2020. Without a phone, they were managing. So why questions towards the community? I'm addressing this community because all of us are associated with the children. We are the parents of children, or doctors of children or teachers of children. So somehow we can help such children. We have to educate the community. So we have to throw this device away from children. This is not meant for children. So speech and delay, when the child is into the phone, when the child is addicted to the screen, the child will not take any initiation in communication. So if you want, so another story is some parents used to tell me, my family, I used to ask them, okay, what time the parents were speaking, how the your family, any history is there without without speech delay and all. They used to say, my grandfather, my father told me, my previous generation, they were delayed in speech, or my father was 5 years only, my uncle 5 years 6 years only, they developed this language skills. So I thought, okay, I will wait for another 5 years. So that is 50 years back or 60 years back, all these parents were facing that crisis. Now the world is different. So if the child is not speaking, okay, 1 year the child is expected to speak.
Sir, can you unmute yourself, Jaya sir? Okay.
Okay, what happened, sir?
No, suddenly it became unmute. It's okay. No,
okay.
Please go ahead.
Okay. So if there is such things, delay in language or any such things, poor eye contact or something, if we are noticing, definitely we have to consult a pediatrician and take his opinion. But unfortunately, if you are consulting a pediatrician, many of the things he cannot find out. Many of the things, because a child with autism, if a pediatrician is checking the child with autism, for medical point of view, the child's everything, medical, blood, his urine, his cardiac level, EEG, ECG, blood test, everything will be normal for a pediatrician. Many pediatricians are referring cases to me. I know that the condition, because sometimes pediatrician cannot find out the condition of the child. That is all behavior.
Let me defend my fraternity here.
Please.
In a busy clinical practice, usually the pediatricians are consulted for acute problems, like child has a fever, he has a fits or convulsion, very emergency cases. Unless you are in a clinic, even in the clinic, the time slot is so small that unless a pediatrician is so careful about looking into the other aspects of the like if you're talking about the spectrum disorders like autism spectrum disorder or ADHD or any of these conditions which we are discussing today, if he is not aware of these things, he may not be able to pick up those subtle things which needs to be referred to professionals like Dr. Jaya Chandran. So I do agree that in a busy clinical practice, these things get missed unless somebody is aware of it and then they're thinking on those lines. Otherwise, they think of the pathological causes of it. Like, for example, somebody is inattentive. First, they will do the audiological testing. Okay. Similarly, if somebody has visual problems, you'll go to the ophtha consultation. So they do all sorts of clinical tests and the imaging and things like this. But very few people think of referring to the concerned professionals like Dr. Chandra. So there's a small explanation from my side. Dr. Chandra, please continue.
That's very good, doctor. Thank you very much. So our focus is, by chance, if a doctor cannot find out the issue, especially eye contact, behavior, hyperactivity and all, there is no machine to find out the hyperactivity of the child. So then we have to focus the delay in communication and the other behavioral condition of the child. Hearing impairment, definitely, if the child is not responding in the first years, maybe first 3 months itself, most of the parents can understand. 6 months, definitely the child will not react to the voice. Then definitely we have to go to pediatrician. All the basic situation, all such children should go to the specialist through a pediatrician. Pediatrician is the right person to see all the milestone of the such children, and definitely he will refer to audiologist, and he will check the hearing condition and the language condition. Muscular dystrophy, acid attack, Parkinson's, and multiple thalassemia. Okay, sickle diseases. Now we are not going to discuss. Let's move forward to autism, because autism is the number of autism affected children are more in these days. Every week, like Friday, Saturday, minimum 5 to 7 children I am getting for the assessment who are referred from different schools in Riyadh. And some are from other countries also. They are coming through like a virtual platform, and we are discussing and identifying. Okay, so what is the nature of autism? So for your understanding, first initial level, like 0 to 2 years, mostly the children's milestone development is normal. You will not find anything unusual in the beginning. But at the same time, I am telling all the autism conditions are not same. Some children, in the beginning, they will not respond. That is like in the very beginning, the problem is there. For many of such children, from the very beginning, see 0 to 1 year, 2 years, normal milestone development. The child will speak, eye contact is perfect, feeding, toileting, everything is age level. But after some time, like 2 years, 2.5 years, the typical condition, classical condition of autism comes after 2 years, 2 to 3 years, I will say. Then suddenly the normal development, normal graph, it will go. Normal graph, it will go. Then after 2 years, a confusion stage. The child will not focus. Eye contact very poor. He wanted to be away from other children. He cannot go with other children. He cannot go and play. He likes some particular place at home. Maybe he wanted to carry some particular things. He may look at a fan or any other rotating things, spinning wheels, repeated. All this is, see, all such conditions, children will do that. But if the children are repeatedly doing all this, and if it is affecting the communication with other children, he cannot go to the people same age level. At least 2 year, 3 year child is expected to go to same level children. Such children cannot go to other children. There is a gap in social interaction. Communication is delayed, and they may develop some odd behavior, unacceptable behavior. Without our expectation, anytime. Yesterday one behavior, today one behavior, tomorrow one behavior. So unpredictable behavior. If you are finding such children, assume that mainly communication, social interaction, unacceptable behavior. Then there is a chance for autism. Many of such children, see, I mentioned this as ADHD. ADHD is attention deficit hyperactive disorder. Attention deficit is there. Such children are called ADD. There are children without a hyperactivity, ADD. So when you call, he will not. If he is playing something, he will not look at you. You may call from behind. Call Ahmed, look at me. No, Ahmed will not look at you. Why? He is hearing properly. Sometimes I used to ask them, is he hearing? Yes. If when phone is ringing, he can go and find the phone. And otherwise, if some music is there, yes. But many of such children, they cannot focus towards the voice. That is attention deficit. No hyperactivity. There are many children, they will, if you are giving a toy, hours and hours, he can sit with given this activity. They are not hyper. Some children are with hyperactive. Such children, you place him behind me. There are sofas. You give a place with a toy. Place him with a toy. He cannot sit. 2 minutes, 3 minutes, he will sit there maximum. Then he will run. Recently, from one Indian school, one child ran from the school. That child was from the home. He reached the Shumesi hospital. The child ran from Hara, Hail Wazrat. That is a central part of Riyadh. And he ran around 6 kilometers. He reached there. Parents didn't know where did he go. And that child is not safe. So such children, they cannot sit at a place. They want to take everything. They want to, with the tantrums. They want to spoil everything, or they cannot be in a safe place. So such children are hyperactive. So attention deficit disorder and attention deficit hyperactive disorder, we have to focus. So children with autism, normal autism is there, classical autism. In the beginning, normal, then affecting communication and social interaction, lack of social interaction and communication. Along with that one, ADD, ADHD. So it's a spectrum of disorder. It's a group of disorders with. You cannot say that I know one child with autism. Don't think that the next child, if you are taking 1,000 children, the nature will be 1,000. Maybe at least 500 plus. Nature will be there with the different. So one autism is different from other type of autism. It's a group of disorder. It's a spectrum of disorder with the different nature of handicapping conditions. Let's go to multiple disabilities. There are multiple disabilities. For example, a child is having hearing issue. Maybe he is using glass because low vision. A child with autism using glass or hearing problem, that is a mixed category, multi-category disability. Are there? They also need support services. If it is mild to moderate, we can educate them in the mainstream with the basic preparation. Otherwise, it will be difficult. We have to think about the alternate arrangements. Then chronic neurological condition, Alzheimer's, Parkinson's, neuromuscular. Basically, such children are facing writing issues. Okay, we have the facility to support such children. I will explain you later. So such children are also there. There are many children in different schools. If you are taking school, I was associated with one research project of Ministry of Education when I was with the ministry when this research project. In every public education system, if you take an international school, 3 to 5%. Means if we are taking 1,000 children in one school, there are 30 to 50 children who need support services, counseling, assessment, speech therapy, behavior therapy. It is mostly, learning disabilities and hyperactive. So 3 to 5%, I will say. Some schools, there are parents with hyperactive disorders. Children will be normal. More, behavioral issues with the parents also. Such a situation is very dangerous. We cannot treat the parent when he is like 40-year-old hyperactive parent is coming to a school for support services for child. That will be very difficult. Okay, let's move forward. So now virtual autism. So now this is our responsibility as the teachers, doctors, parents, whoever is working with such children. We have to stop the parents using mobiles or iPad or any such screens. Just like normal condition, half an hour, 1 hour TV in a day, that is more than enough. At any cost, don't allow children to use screens. Okay, if you have any question, please mark it. Later we will discuss. I'm moving forward. Oh, yeah. Oh, sorry. Yeah. Okay. What is our responsibility as the parent or as a professional? What we can do if there is any high risk factors during pregnancy? Okay, you just to communicate with the parents. See these scores. I will say these are the scores. We can find out the issues. Okay, see the label. Beware of this risk. If there is any such issues as in the list. Any high risk factors during pregnancy. For example, pregnancy time, the mother is, having any health issues, diabetic, thyroid, or any accident, stress, using antibiotics in the first trimester or end of the trimester, all such situations. It is a risk factor. Poor birth weight of the child, if it is under 2.5 kg or above 3.5 kg, this is a high risk factor. Excessive medications, any genetic issues, if there is any family history of such a situation, what we had discussed before, in such a situation. Premature birth, okay, before maybe some children 6 months, 7 months, 8 months, before 50 weeks, very, very dangerous situation. Prolonged labor, the delivery time, it's prolonged. That is very, very critical situation. Anoxia, oxygen deficiency, oxygen supply to the child during delivery. Most
Dr.
probably that's such.
Dr. Chandran, sorry to interrupt. As
Yeah.
majority of the attendees I can see are from the teaching background. So what we can do is, I mean, if they want to take a screenshot of these causes, is fine, because the focus should be more on, the therapeutic aspect. So what we can do is, let them take a screenshot of the causes. In brief, it's like, if there are any concerns for I mean, if you are concerned about the preterm and the other medical issues at around the birth, like for example, prenatal, natal, and postnatal, we call it. I mean, during pregnancy, at birth, and after birth. If there are any concerns, you need to, I mean, while taking the history. So if you find that something is suspicious or that could have led to this condition, you can always make a point and refer. So you need not go into the detail of how what is the preterm age group and all those things. So I request Dr. Jayachandra, let's focus more on the therapeutic aspects. We can briefly go through it and let them, make up their mind for the questions. Is that okay, Dr.
So
Chandran?
any such, yeah.
Yeah,
So
please.
any such situation, the suspected situation, just refer the child to a pediatrician or any professional related to this one, and the child should be assessed in the early stage. Before 3 years, the condition should be assessed and referred to support service system, as Dr. Shafiq mentioned here. Okay. So early assessment, I mentioned here referral services, where to refer. So as the parents, your first reference, source of reference is, there is no doubt, pediatrician, or any person who is associated with a medical field or rehabilitation system, or a psychologist, you can refer. Then first is, they will do the treatment if it is possible. Any disability condition, definitely they will go for example, eyesight, definitely they will go for treatment. Hearing impairment, they will put a device or any other such a situation, cochlear transplant or such things. Then support services, I'll explain in detail. Assistive technology, see, there are many support service technology for children. For example, we were if the child cannot move the hand, the child can type with a communication board and all. This is a technology. Hearing impairment child, the hearing aid is a technology, or such technological innovations are there. So doctor or a specialist can refer to use such technology. Then the basic thing is education. So 3-year-old child, once he is assessed with any such issues, any such disorders, can we start the education? So most of the time it is happening, the child, when they go to school for admission, they will reject admission because they will say the child is not speaking. Once they are admitted in the school, they may complain that the child is not sitting, the child is not behaving properly, the child is not sitting in the class, the child cannot write, the child 4-year, 5-year-old child is not toilet trained, the child is not able to follow the instruction of the teachers. Recently, one child parents told me that the child vomited in the tiffin box and put it in the bag. Okay, such a situation, it's a dangerous situation. So what to do with the such a situation? This is the area we have to address. Then the empowerment, we have to focus empowerment of the child as well as the parents. Many of the parents don't know how to manage such children in school, at home, and many of the teachers don't know how to manage such children in school. Then we have to prepare the child for the mainstream education or a special education setup, considering the functional level of the child. Functional level, see, intellectual level, the intelligence should be normal for the education. By chance, if the child cannot cope up with the regular, curriculum, some sort of, we are not expected to teach everything to all the children. So some sort of curriculum adaptation we can do and manage such children. And if the child is facing more difficulties, we have to refer such children to rehabilitation support services. I will explain in the next slide. Okay. So what changes you can bring as a parent or teacher? So the first thing is special needs education based on the functional level. As I said, IQ level IQ level is less than other children. Focus on the curriculum based on the functional level and IQ level of the child. Take only limited curriculum. Don't go for the 100% curriculum. Do the curriculum adaptation with the support of specialists. Maybe 50% of the curriculum you can teach to the child. Instead of teaching the height of Himalaya, you can teach the child's his height and father's height to measure. Okay, so no need to go for functionally what the child is required. No need to go teach him everything. So the functional curriculum we have to select. This is the task of the teachers. Don't teach everything to all the children, because 50 children in one grade, two or three classes, the children are going to in a diverse society. So based on the capacity of the child, teach the child. Then mainstreaming. Can we enroll all the children in the public school? It is not possible based on the skill of the child. If the child can be educated in the mainstream school, regular school with the basic support services, yes, you can. Otherwise, refer the children to, I will not say that all the children are suitable for special schools, but mainstream school, if the child cannot, there is no other way. But if the child can learn 25%, 10%, 50% in the mainstream, 2 hours, 3 hours, if he can sit in the classroom in mainstream, allow the child to be in the, if the child is not aggressive or dangerous, we can enroll such children in the mainstream, because CBSE or all the state boards allowing special provisions to support such children. Okay. Now, so early enrollment is the first criteria we can do, then facility management. Yeah, this is the area where Dr. Mentioned about the support service system. If the child is not able to be in the school system, in our school, able to follow the curriculum, behavior pattern of the school system, pediatrician, a psychologist, a speech therapist. If the child is not speaking well, give speech therapy. If the child is not behaving well, not attending well, hyperactivity is there, behavior therapist. If the child's fine motor, he cannot hold the pen, Some children are holding like this. The child cannot hold the glass. The child cannot tie the shoes, buttoning and unbuttoning, fine motor issue. Any such issue is there, give occupational therapy. Some of the children cannot move properly, physiotherapy. There are many therapies. Hippotherapy is there. The child's, the movement, autism and all, hippotherapy is there. Hydrotherapy is there. Hippo means using a horse to support. It is not available in Saudi or India. You can enroll, they are using. Hydrotherapy is very good. Swimming exercise. So different therapies we have to refer, and some sort of vocational, pre-vocational training, prepare the child for all the fine motor, gross motor skills to develop creativity. So it should be referred to such people at the early stage, 3 to 4, before 5 years, all the therapy should be offered to such children, so that 6 years, 7 years, the problem will be solved. So what is happening in school is some of the children, many of such issues are identifying 7 years, 8 years. Recently, a 25-year-old young man came to me for counseling. He is working in a company, a very good salary. He passed graduation. He got a job here. The problem is he cannot continue the job there because he cannot socialize. He want to sit there one place. He cannot communicate with the people. When I asked, the parents told me that he got some sort of support service for writing examination, CBSE examination in the school. They arranged the scribe, they arranged extra time and all. He passed. The problem, they don't know what is the exact problem of this person. When they came to me, I only identified that this 25-year-old man is having autism. 25 years. What is the use of, see, now he cannot work at a company environment. He cannot communicate with the. So once it is delayed, this will affect his entire life. Another person was recently 40-year-old man. You know what he want to do? The social interaction, communication is very poor, but academically he's a brilliant person. Now he want to kill his father. 40-year-old man, he want to kill his father. When I assessed, there was a mild form of autism is there with this man, 40-year-old man. And nobody knows about it. Parents don't know about this one. His school could not identify the issue. Now he want to kill the father. This is a situation. See these two examples. Once it is delayed in identifying such issues, ADD, ADHD, especially autism or hyperactivity, if it is not identified, it will be beyond the level. If the parents cannot control the child within 13 years, 14 years, then maybe society will control. Somebody has to control. Maybe the society will take the control after 13, 14, or 25 or 40 years. So our responsibility is, as the professionals, teachers, parents, students, or whatever it is, identify such children, refer such cases to the concerned qualified people. Don't go to a layman's, don't go listen to a layman's language. There are many Facebook universities and WhatsApp universities. They will give many wrong information. Don't listen to any such things. The parent will say that my uncle was speaking after 5 years. My uncle was hyperactive till 10 years. Don't wait for your uncle's, that is different case. Your child is uncle and auntie, grandfather and all that family. There were 10 or 15 children those days. Now you have only 1 or 2. So at the early stage, 2 year or 3 year, we have to identify and refer such children to efficient support delivery system. Yeah. So enrollment, facility management, inclusive curriculum to include the children in the mainstream society, acceptable curriculum. As I said, don't go for everything. Don't teach them everything. Acceptable, adapted curriculum. Adapted means, if you, in a ground, if at the school ground, 20 or 30 children will be there to play football. If a child with a disability cannot play with the other children, maybe he is wheelchair bound. Okay, one attempt, just to give a ball to such a child, wheelchair bound child, and give one ball to such a child, let him attempt one kick. That is adaptation. Curriculum also, the similar situation is there. So such modification should be there with the support of professional. So who are the professionals? As I said before, different therapists are there. Then special educators are there who are trained in the particular disability area. Autism specialists are there. Learning disability specialists are there. Mental retardation or challenging, mentally challenged, that area specialists are there. Visual impairment, hearing impairment, deaf blind. So any disability, teaching specialists are there. Refer such people to their for their opinion and their consultation, and we can support such children. Okay. The aim is, see, Person with the Disabilities Act or any Disabilities Act in any countries, 196 countries, I believe, or 156 countries signed in the WHO Conference on Disabilities for equal opportunity, to offering equal opportunity to all the children. So if I am the principal of one school, you are coming to me legally. I should give an equal opportunity to this particular child. You are coming with a visual impairment, hearing impairment, autism, or any disability. Legally, I should be able to, as a principal or as a teacher of the school, I am committed to law for offering equal opportunity. Protection of right. What is the right? Right is every child should be access to education. That is the right of the child to get education in India. Legally in India. Now question I am talking here from Saudi Arabia. Then you can ask me, you are talking about the Person with the Disabilities Act and right of person with the disability bill passed in 2016. You are talking about the equal opportunity, protection of right and full participation. You are talking, but when I went to Indian school or other school, Indians managed private school, they said no, I cannot take the child. Is this legal? The right is not applicable for this one. They can say no, this is not a Indian, because the setup, this is a Saudi setup. Then we have to follow the regulation of Saudi Ministry of Education. They can say. They said this is, I cannot come to a conclusion. This is a debatable subject. But legally, in Indian situation, the child should have equal opportunity. This disability bill offers equal opportunity, protection of right, and full participation. Full participation in schooling, enrollment, in sports. One child cannot attend a program because child's behavior is you cannot discriminate the child. For example, a school is arranging an excursion, a tour to another city for something, a science exhibition. You cannot, legally, you cannot exempt one child from a school activity. So this child also should, otherwise you have to, if the child is dangerous, if it is not safe, you have to convince the parent, okay, because of this is the reason. We cannot take with the group. Can you take the child and reach? Okay, we are going to Daman for a program, or we are going to Dubai for a program. Okay, with this group, the child will be aggressive. Can you arrange transportation or you can bring the child? So, but you cannot discriminate the child legally. So these three words we have to keep in mind. Right of the Person with the Disabilities Act offers equal opportunity, protection of right, and full participation. For what? To give, see these 3 points, to equity. Equity means sorry. No, I don't want to spend more time. Process of fair and respectable treatment. Okay, considering the diversity. There are different category, different group, different ethnic group, different religion, different region, different language, different disability, different skill, different ability of the child. But the child should be respected, accepted equally in the classroom situation. And purpose of this is, purpose or aim of this one is inclusion. Include the child, accept the child, include the child in the social life, academic life. Inclusion is a process of including everything, considering the differences, considering the disability differences, considering the skills. Maybe I am good in some area. Maybe I am good in maybe sports. I am poor in arts. I cannot draw properly. I should not be discriminated. A child with a disability is coming in wheelchair. He should not be discriminated based on his handicapping condition or physical level. Legally,
Dr. Jayachandra, sorry to disrupt you. You can take a break of 10 seconds or 15 seconds so that you get refreshed. Meantime, I just would like to remind our participants, to be ready with their questions. And if they want to put in the chat box, that's fine. Otherwise, when we allow you to unmute yourself, you can ask the questions. Dr. Jaya sir, there are, majority of the attendees are from the teaching background. So their main concern would be, how to deal with the children in a common classroom. I mean, for example, a class of normal kids plus somebody, who has special care needs. So how to manage such classes? Second is what resources are available in locality in the region if there are no qualified people around. So what best they can do for referral or managing. And as far as the parents are concerned, if you can guide what are the local referral centers or someone who can deal with such cases. One more question which came about the hypnotherapy. So I'm just giving you a hint so that when we come back after 10-15 minutes second break, if you would like to take them towards the therapeutic side, that will be great from your side. Would you like stopping the screen share for 10 seconds so that we give some time break for the audience?
Yeah, another now it's 1 hour. So how long I can continue, doctor?
Yeah, that's what I'm saying. So we'll just take some questions so that we know which direction we are going. If you can stop the screen share, I'll just give them a pause so that they become refreshed.
Okay, fine.
International Indian Professionals Association, IIPA, a dynamic platform dedicated to connecting and empowering Indian professionals living overseas. At IIPA, our mission is to harness the diverse talents, skills, and experiences of Indian professionals to strengthen and uplift the global Indian community. Through collaboration, support, and engagement, we aim to foster a thriving network that facilitates knowledge sharing, professional growth, and cultural exchange. By building a strong network of skilled individuals, we aspire to create meaningful opportunities for development and to empower our members to make a lasting impact within the Indian expatriate community. We believe that together we can achieve extraordinary heights. Through a range of workshops, networking events, mentorship programs, and community service initiatives, we are addressing the unique challenges faced by our community and helping our members reach their full potential. Join us on this exciting journey to build a stronger, united, and resourceful Indian professional network. Together, let's make a difference. We are thrilled to introduce the International Indian Professionals Association, IIPA, a dynamic platform dedicated to connecting and empowering Indian professionals living overseas. At IIPA, our mission is to harness the diverse talents, skills, and experiences of Indian professionals to strengthen and uplift the global Indian community. Through collaboration, support, and engagement, we aim to foster a thriving network that facilitates knowledge sharing, professional growth, and cultural exchange. By building a strong network of skilled individuals, we aspire to create meaningful opportunities for development and to empower our members to make a lasting impact within the Indian expatriate community. We believe that together we can achieve extraordinary heights. Through a range of workshops, networking events, mentorship programs, and community service initiatives, we are addressing the unique challenges faced by our community and helping our members reach their full potential. Join us on this exciting journey to build a stronger, united, and resourceful Indian professional network.
Okay, Dr. Jayachandra, you're back to...
Yeah.
Yeah.
Yes, doctor. So I will not take much time. I think 5 to 7 minutes. I'll wind up the my speech, and we will go for questions.
If we can focus more on the therapeutic aspect and the practical steps the parents and teacher need to address.
The questions you asked is in the classroom situation, how one teacher can manage. There are hundreds of strategies. One strategy for a regular classroom teacher, I will explain you. See, the first one is if the child is enrolled in a higher classes, higher level, if the child is there, such children are there, we can follow peer tutoring method because the teacher is busy with everything. One class is there, 40 children, 30 children, so teacher cannot do. So identify one child, assign him to support the special child. They will not say no to that. It is called peer tutoring. So when you teach something to someone, you will learn more. Convince such children, the volunteering, such children, explain him, focus him to support such children. Then another strategy is there called cooperative learning, group activities. One child is poor in one activity, maybe coloring or a project. If the child cannot, make a group of children, assign them to support such children. So that is the second activity I can suggest in a mainstream higher level classroom. Then if behavioral issue is there, counseling and behavior therapy. Curriculum, adapt to the curriculum. Don't give full curriculum. Select the curriculum based on his functional level and the intelligence level. And if CBSE or if it is a CBSE school or a state syllabus school, there is a provision to support the children for the examination. There is a special provision for such children based on the category of disabilities. They will get the extra time for every 1 hour. They will get 15 minutes extra. Means 3 hours public examination, they will get 45 minutes extra. Hello, can you hear?
Yeah, please.
Okay, so 45 minutes extra they will get. And if the child is having the severe disability, if they cannot hold the pen, if they have shivering or any neurological situation or severe language disorder or disability, they can get a scribe. Scribe means a writer. So you have to give the disability certificate to the authority, CBSE or state board. They will check and they will arrange school. They will assign school to arrange a scribe. Technically, it is called scribe or amanuency. That is the technical word they are using. So such children will get a scribe to write the examination. This is the answer I can give in this particular webinar because it's a broad area. Considering the child's condition only, we can come to one conclusion. Yes, doctor, any questions?
Yes. Yesterday, there was one program for those who want to avail the higher education, like medical or engineering in the kingdom. So
Yes.
in that, during the question answer session, one parent asked a question, which I thought maybe we can get the answers from this side. So his question was like, if suppose somebody is having some disability, or maybe he has some special education needs. So in this case, do higher education institutions give any concession or consideration for application acceptability or admission process? Is there any something like this in the kingdom for expatriates at least?
You are asking about the expatriates.
Yes, yes.
Okay, for expatriates, higher education, you know that it is only 12th grade they can study. Now, recently they started enrolling such children. For expatriates, there is no such a reservation system for. But for the employment, if one disability, a person with a disability is working, there is some provisions are there because for the Saudization, they will balance with. For higher education in Saudi Arabia, as of now, there is no support services. But scholarships are there for the higher, for example, if any university is giving an engineering, this one, maybe when they will do the interview and all, they will. But in India, yes, answer is yes. 3% of reservation is there for higher education, considering the, mostly focusing visual impairment, hearing impairment, and intellectual disabilities. 3% of reservation is there for most of the courses.
Okay. One more question in the chat box was like, most of the teachers in normal schools are not trained well to identify such kids and refer to the professionals. So in this case, what should be the role of a teacher?
Okay, I am proud to say that in 25 years back, I was one of the faculty for national level trainers program. Government of India launched the program to train all the teachers in India. But assume that how many, we have millions of teachers in India, we cannot train. And with that was like a 10 to 15 days training. We were training master trainers and they were going to, grassroots level. That program was there. But it is very difficult to cover all the teachers. But if the teachers want to support such children, don't wait for the government, do some sort of training program to address the educational needs of the children. Personally, I will say I am planning, with my organization is planning to conduct a short level training program for the teachers in Saudi Arabia and Middle East. If anybody is interested to join the program, they can send me a WhatsApp message. I'll share the number later. We will be conducting a training program for the teachers. It's like an online program we are planning.
Yeah.
And
that...
if they wanted to continue some sort of training program, there are some certificate courses in some particular, because disability is a vast area. Certificate courses are there or diplomas are there. They can get, but they cannot be a special teacher by getting online certification, because Government of India stopped that. All the certification should be accredited by Rehabilitation Council of India. The professional who are working in the rehabilitation, same like Medical Council of India, you cannot practice in India or abroad without the accreditation of Medical Council of India. Similarly, Rehabilitation Council of India is the authority for certification of any support services. It should be under the accreditation and registration.
Yeah, whenever
But
such
for
course is
getting knowledge, yes, you can get do some like online course or some diplomas.
Yeah. Whenever such course is launched, please do share the notification, because we have teachers group from the IIPA also. So where other teachers who are not present today can also benefit from such courses.
That's
Basically,
sure.
it is to empower the existing teacher. As you said, it is not, it will not entitle them as a special educator, but at least they will get some knowledge while dealing with such kids, and they can identify, such vulnerable kids and refer to the professionals accordingly.
Doctor, you asked me one question before, but I couldn't answer completely. See, this services, you were asking about services. This slide gives an entire spectrum about the services. Just I request all of you to have a look on this one. See, early assessment, psychological and behavioral assessment, educational and functional assessment, occupational assessment, physical, then IEP planning. IEP is individual education plan. All such children, based on the capacity, functional or disability condition, we have to develop a program for each children. That is basic component of special education. Okay. Then support services, therapy services, as I said earlier, family guidance and counseling, assistive technology, follow-up in rehabilitation, other support services. For example, as you said, higher education, reservation, empowerment, information and all. So these are the spectrum of services. Holistic services, I will say. Yes, doctor, next question.
The next question is like, one child is doing very well in all other subjects, but he has a fear about the fine arts or arts class. Okay.
Yeah.
So ultimately, he just gives up, and so is there anything to be concerned? This is the question from the.
Yes, if one child is not able to perform well in one particular area, CBSE and most of the state boards, there is a provision, you can opt another subject. For example, if the child is not able to study mathematics, okay, he is good in arts or he is good in maths, for special children's provision, as per CBSE exam law, you can opt another subject. But one language should be compulsory. One language is must. Remaining, you can opt the subject once the child is labeled as certified as disability.
Next question is, what is the disability certificate and how and where to apply for it?
Okay. Disability India District Medical Board is the authority to issue the certificate. District Medical Board, there are 5 specialists will be there. You are very aware about that, doctor. a pediatrician will be there, a psychologist will be there, a physical medicine specialist will be there, or 5 specialists will be there for maybe sometime 3 or 4. Once the disability is severe, they will get. The problem is once we are taking the child to India for certification, usually we have to stay there. Last weekend, I got one child with autism. Okay. This parent went to India, they stayed for 5 days because the first day pediatrician, second day physical medicine, third day ENT, next day psychologist. So it is very difficult. But here in Saudi Arabia, the children who are attending examination, CBSE examination, I used to do because I'm a registered rehabilitation practitioner under Rehabilitation Council of India. And I was the counselor of all the Indian schools. Embassy assigned me as the counselor long back before joining Ministry of Education. So I used to certify the children, those who are, but sometime if they have any doubt, they used to reject. Then they will ask them to go to district medical board and get the certification. For Indian children who are studying in the Indian school and applying for CBSE examination, I can do that, but chances are there for rejection. Last year there was, I think I certified like 10 or more. Last year there was one rejection. A child from Trichy, she couldn't get the approval, and they suggested to go and get the certificate of medical board, district medical board. District medical board is the otherwise national institutes. National institute like Secunderabad National Institute is there. All India Institute of Speech and Hearing is there. National Institute of Hearing, National Institute of Visually Handicapped, Dehradun. They can also give the certification.
One child who is in grade 6, usually he forgets sometimes pen, sometimes book, sometimes tiffin, and so is this forgetfulness, is it normal, or parents should be concerned? Like sometimes he doesn't even know that there are some more questions in the question paper, so he just leaves the questions, and then later he realized that I didn't notice it.
Child is forgetting something is not a legal disability, but grade 6 child frequently forgetting means there is a chance of learning disability or low intelligence level. The child, such a child should be referred to a specialist, and a proper assessment should be done.
Is there any link between autism and IQ level? I mean, if somebody says some child is autistic, does that mean always that his IQ is low?
No. All the children with autism is not intellectually disabled. That is autism is normal. Autism is affecting only communicate. But there are many cases children with autism are having low intelligence level. But if you are asking me, is this because of autism? No, there are many other children also. Out of like 3, if you are taking 1,000 children, maybe 30 to 50 children are with so. Autism also the same condition. If you are taking autism like 1,000 children, maybe 30 or 40 or 50 children will be there with the low intelligence level. Otherwise, autism is not related to intelligence level. Yeah. I had hundreds of children with autism with a high functional level. There is a term, high functional autism is there.
Thank you. There is one question, like I think from teacher. In a class, like usually mild ADHD gets missed or maybe not recognized even by parents and the teachers. So such kids disturb in the classroom a lot. So in a normal school where 1 or 2 such kids can spoil the whole lesson plan and other teachers concentration. So how do they manage? They should manage.
Okay, first is we have to assess the condition of the child. If it is a mild condition of the child with the ADHD, attention deficit hyperactivity, and intelligence, if it is mild, most of the 90% the regular classroom teacher can manage with some sort of adaptation. But if the teacher cannot manage the child in the classroom, it is very dangerous for other children, because not recently, around 15 years back, one child jumped from one school building. The first day of school, the child jumped from the building. If the child was hyperactivity severe, the child died on spot. It is in Riyadh. I assessed the child the previous day. Okay, if it is a hyperactive child, we have to convince the parent. We have to refer for hyperactive. behavior therapy. We have to, balance the diet. We have to see the what type of food he is using. Is he using screen? What type of medicine he is using? Everything. Then neurological support also needed. If it is a mild category, if there is no dangerous, teacher with some sort of adaptation in the class, teacher can manage. Otherwise, if it is difficult, don't take the risk. Refer to a specialist and take the opinion.
One parent is asking, like, one child went to a school normally till grade 2, and then after that he stopped going. So, is there any problem? This is the concern from the parent.
The school only can tell, or parent only can tell why they stopped. Why they stopped? What is the reason?
Okay, I think I would like to address that parent. That first of all, we need to go from simple things to complicated things. Simple things could be.
No school will stop the education of the child. There will be a specific reason. Maybe the child is not safe, or other children are not safe.
Yeah. So maybe there are simple things like, students bullying him, and, that's why he's scared to go. Could be one thing. Or in a bus where he's going, the other students make fun of him for whatever, either he's short stature or height,
We have
he's
to
too tall.
identify the reason. What is the reason for?
So we need to identify from basic things. And then if you find that there is no other obvious silly reasons, then we need to go for medical
Child
reasons.
should be
Are
in
there
the
any
school.
issues with, learning disability, which is manifesting now, which was not
Yes.
recognized early? So this could be one reason. My next question is, okay, explain high functional ASD, autistic spectrum disorder, how the kid can be engaged in a normal school. I think this is from a teacher. Yeah.
High functional children, if there is no hyperactivity, they can easily, maybe the child will be away, maybe the socializing will be difficult, but academically he will be doing very well. I got many such children. They are enrolled in various international schools in Riyadh or different countries. They can perform very well, but some sort of adaptation, we have to make other children to understand what is the condition of such children. He can study in if there is no hyperactivity, the child can be enrolled and continue the education. We can refer such children for higher education also.
There was one comment in the chat box regarding hypnotherapy. Is it relevant to us today? I mean, in this session?
No. Hypnotherapy is not for disability. That is for a psychiatric disorders. They are doing something. I don't know anything about that.
Okay. Anybody would like to unmute themselves and ask a question directly till I reach the questions in the chat box?
Doctor, in the screen, I put some of my books, on the subject what we discussed. Yeah. Those who means especially teachers, those who are interested to learn more about the subject we have discussed. I have the first book, Know Your Child First. This is talking about the disabilities and the issues, how to address. Then second book, Special Education Theories to Practice. That is how to manage special education in the broad spectrum. Then challenging the challenges, we are talking about the challenges, how to address the many questions you asked. This book that is discussed. The next book, another book, it is
Asmat Bey, please mute themselves. Asmat Bey. Okay. Please go ahead, Dr. Chair.
Okay, I have some other publication. That is not two books, essays on women empowerment and insight into careers. That is, I am a co-author of this book. That is edited by another friend. So I am talking about vocational education prospects of special needs people in the career, and women empowerment about managing disabilities in the community. That is what so I have around 7 book publication.
Yeah,
I'll take books, for Ministry of Education.
Yeah, I'll take one last question. I think it's from teacher. She has a student who is 5 years old but unable to concentrate or focus in any manner. He's unable to talk or having issues in fine motor skills as well. So do you have anything to say on this, Dr.?
Suspect of autism or learning disability, because fine motor affected, eye contact affected. If the child cannot sit at a place for a long time, suspect that he is having autism, but we cannot certify with this tooth symptom only, and proper assessment is suggested for to ensure that the child is having this particular issue.
Is there any question? Because we are running short of time already. We have overshooted our scheduled time. So if there is any question, please unmute yourself and ask directly, because it's very difficult for us to read the chat box at this last moment. And if any practical questions you'd like to ask, like facility availability or anything, just unmute yourself and ask directly, please. Any language. Hindi, I can translate for Dr. Jaya, and maybe Malayalam, I think Dr. Jaya can understand directly.
All the
And,
South Indian I can manage, doctor. Hindi partially.
So please, because we need to close, we are running short of time.
Yeah, and my number is also there, doctor. If anyone want to communicate with me further for any support services, it's my pleasure to support.
Yeah, sure. Meantime, before we close, I just want to make an announcement that, we keep coming up with very interesting and relevant and important topics as webinars. I think official IIPA group link has been shared in the chat box. Those interested to join to get the timely notification of the upcoming webinars can join there. And there is a special group link for the teachers, both male and female. You can choose appropriately and join the group to benefit from the notifications there. And do give us feedback so that we keep improving ourselves, and then we try to bring more effective and impactful sessions for you. Thank you so much for a patient listening, and we had a huge gathering, especially from teachers. I appreciate their mentors and supervisors and principal who have motivated them to attend this session and benefit from Dr. Jaya Chandra's very informative session. I know in one session, it's very difficult to cover such a huge topic. He tried his best to bring snippets from here and there. Definitely, we would like to benefit from his training session whenever he launches it. And definitely we'll collaborate and make it more beneficial for all the participants. Thank you so much. Thank you, Dr. Jayachandra, for your time and effort. I know you're very busy. It was very difficult to catch up with your appointments, and I'm sure the participants also got benefited. So please give us, your feedback on this.
Thanks for your invitation, doctor. It's great to be with you professionals, and let me also get to the field. I know that it is, in a short, around 1.5 hours, it's difficult. It will go like hours and hours if you are talking, but within 1.5 hours, it is very difficult to convince, to convey my idea to people. But I tried my level best to. I was running fast, but I tried my level best to give hints about all this area of special needs, disability, and the management of special needs. I must thank you all, and thanks for your kind invitation to join for this wonderful webinar. Thank you.
Thank you, sir. Thank you so much. Thank you.